about some knee pain. So we have all had it. You know, you take a step wrong off of a stair, or you're, trying to go up the stairs and you feel a little twinge, and every step after that, it kind of just feels irritated, or something's kind of biting you inside of the knee. Pretty common, pretty standard. It's what you do afterwards. It's how you respond to these symptoms that really makes the difference in, is the symptom going to be, present for a chronic time, for 6 weeks plus, or is it going to just self-limit and heal on its own? A lot of times, pain is just an alarm system. It's just there to tell us, hey, something happened, right? You step on a tack, it sends that impulse into the spine. That spine sends the impulse to the brain. That brain is where that pain sensation is generated. The brain outputs that pain and says, hey, let's pick up the foot, something's going on, let's check it out. A lot of times we can be in similar situations as a past injury, and we will get similar pathophysiological responses despite no injury occurring. It's happened plenty of times with patients that I've seen who, they've had surgery for their ACL when they were younger. They were playing basketball, they landed wrong, they heard a loud pop, and then they went and figured out that the ACL was destroyed. They had surgery for that, they rehabbed it, everything's been good for the last 15, 20 years. They were playing a pickup game with their buddies. They heard, a rock fly across the court and hit a loud trash can and made a similar ding to the, the initial injury. Their knee swole up, they had pain, they went to the doctor, they got an MRI, and everything was completely fine. So that happens too. And that's where you start to get into the nitty-gritty of what is actually pain. What is pain science, quote unquote, and how do we get beyond those symptoms? And a lot of times it's really just about showing the body how resilient we are. So when it comes to the knee, there's a lot of things that could go wrong. You can have ligament damage, you can have patella maltracking that causes some issues to where you're having some pain when you're bending and straightening the knee. You can get some bursitis, where those bursa sacs underneath that are supposed to be relatively flat and smooth, full of fluid, so that the tendons and things can glide without causing irritation. You can get some swelling there to where now those are painful and they're swollen. There's also all kinds of other things that can happen. And it doesn't even have to be a mechanical sign. You can just have pain in the knee from whatever reason. Referral from the back, referral from a peripheral nerve, referral from an area that's not actually the knee. So it's important to understand what's going on, what happened, what started the initial pain. Was it random? Was it an acute injury? Did something happen and that's exactly why the pain's there? All that plays a role, and we'd love to help you figure it out. If you feel like your knee's not responding to these, isometric free knee pain guides, then give us a shout. We'd love to see you for a discovery visit. It's completely free, no cost to you. We'll spend some time talking about what's going on, typical presentation, typical timelines to recovery. We'll talk about things you might be doing at home that are keeping the knee angry, and we'll talk about things that you can do beyond these workbooks to keep you feeling at your best, to get you back to life, to get you continue making memories with the family and the ones you love.